My name is Steph. I am the clinic director in Sutton. I have been a PT for 10 years and I have been at CPT for 4 years, and I went to PT school at Simmons in Boston. So my favorite part of PT is getting to work with a wide variety of different patients. So I work with pediatrics as young as like 6 to 8 weeks. I treat a lot of neurologically based patients, like patients with Parkinson's disease or post-stroke or with vestibular symptoms or post-concussion. I also treat orthopedics. I am particularly interested in treating patients with shoulder pathologies. And I am very interested as well in working with geriatric patients in that population. So 2 years ago, I got my dry needling certification 1 and 2, which allows you to dry needle both upper and lower body. And some of the ways that I utilize dry needling are for really any orthopedic injury, different headaches, things like that. And so the purpose of dry needling is that when you have a muscle that's chronically really tight, you have a buildup of a chemical called acetylcholine, and it gets stuck where the nerve talks to the muscle in the neuromuscular junction. And so if you have acetylcholine in that neuromuscular junction, the muscle's not able to relax until the acetylcholine kicks out. And so dry needling can help with reducing pain. It causes like an inflammatory process that can help with healing of muscle and soft tissue. And then it also allows muscles that are chronically tight to relax. A lot of times patients will come in with dizziness, and sometimes they have what's called BPPV. And so I treat a lot of positional vertigo. And then I also treat vestibular hypofunction, which is when a patient has a vestibular system that's not operating as effectively or as well as it should be operating. So in terms of dizziness, those are some of the things I treat. In terms of pediatrics, I treat a lot of coordination disorders or low tone kiddos or kids who have had injuries at birth or a stroke at birth or different things like that. In terms of older adults, we'll treat a lot of low back pain or just deconditioning or inactivity that kind of causes muscles to atrophy and not work as well as they should. So that can elicit pain or just difficulty walking or with balance. And then in terms of shoulder pathologies, we treat a lot of impingement, rotator cuff repair, total shoulder replacements, different things like that. So we see a lot of variety here, which is great.